Okay, our next speaker that I'd like to invite to come up to the podium is Eunsil Cheon, and she's received a Master of Public Health degree from the Graduate School of Public Health at Seoul National University, and is currently a PhD student at the same institution. Her primary research interests include tobacco, particularly the use, patterns and spread of e-cigarettes and heated tobacco products compared to and related to conventional cigarettes, and is also interested in tobacco endgame policies, especially because of the use of e-cigarettes and heated tobacco products is closely related to these policies. Recently, she has been studying HTP use patterns using cohort data in Korea. Thank you.
Good afternoon. It's really nice here. My name is Eunsil Cheon. Today, I'm really honored to present our team research results, study titled The Impact of Tobacco Endgame Policies on Smoking Prevalence, Population Health and Cost, a systematic review of modeling studies. Before we begin, I would like to disclose that the study was supported by the Korea Health Promotion Institute as part of the project strategies and task for the development of the tobacco endgame roadmap in 2023. The authors declare no conflict of interests. As you all know, the need for effective tobacco endgame policy is growing, and these policies are crucial for tobacco control. While many studies have examined the health impacts of these policies, there's a need to synthesize these findings to provide a solid foundation for evidence-based policy development and prioritization. Therefore, our team was curious about which tobacco endgame policy exhibited the greatest impact. As a search strategy, we use 5 databases and keywords related to simulation models and endgame policies. The inclusion criteria focused on the simulation studies that examine the tobacco endgame policies, aiming to reach near zero prevalence in specific period goal. We extracted and synthesized the data using 10 endgame policy types and 4 outcome measures. The endgame policy categories were based on the research by McDaniel and Prolevich et al. The outcome measures included smoking prevalence, deaths averted, life years, and economic costs. We included 29 studies in our final review. The VLNC was the most frequently included, followed by TFG and tobacco tax increase. And 10 studies included Empower in modeling scenarios. The studies were mainly conducted in New Zealand and United States and Singapore. The quality assessment scores range from 1 to 8 out of 9. These are the findings. A total of 19 studies examined the impact of endgame policies on smoking rates. Policies such as the nicotinization, redesigning cigarettes to make them appealing, TFG, and increasing tobacco tax were particularly effective in reducing smoking rates. The most common scenario combinations included VLNC, TFG, and tax increase. The policy combination of the greatest reduction in the smoking rates was POWE policies with a tax increase and TFG with retailer reduction. 6 studies saw a reduction in premature deaths. The findings indicated that the combination of the nicotinization, TFG, and retailer reduction policies could avert a significant reduction of deaths. The impact of these policies vary depending on the birth cohort, with greater reductions observed in populations with higher baseline smoking rates, such as Maori people. 13 studies assessed the gains in inequality and HALI. The greatest gains were observed in the implementation of the nicotinization, TFG, and the sinking lid. These policies were particularly beneficial for Maori and Black populations. And finally, 7 studies evaluated the economic impact of endgame policies. The combination of the nicotinization, mass media campaigns, retailer reduction, and TFG resulted in significant cost savings with maximum of over 31 billion US dollars saved. This research reveals several key insights and challenges regarding the impact of tobacco endgame policies. First, we observed variability in the outcomes reported by different studies. It's primarily due to differences in population, simulation model assumptions, and duration span. Second, most of the studies included in our review were conducted in high-income countries like New Zealand, US, and Singapore. This geographic concentration suggests a research gap in low and middle-income countries. Therefore, there's a pressing need for studies that explore the impact of tobacco endgame policy in diverse economic contexts. Third, our review finds that combinations of endgame policies generally produced more substantial health benefits than single policies. Combining denicotinization, TFG, and increasing tobacco taxes resulted in the greatest reductions in smoking prevalence and the highest cost savings. Fourth, it was important to use empirical data from each country. The study results varied by assumption related to the national context, which could lead to different policy priorities. Additionally, the effectiveness of endgame policy varied among different population groups. Policies such as VLNC and TFG showed higher gains in Nicotine and Hollies among Maori and Black populations. This indicates that endgame policies can potentially reduce health disparities if designed and implemented with equity in mind. In conclusion, tobacco endgame policies significantly had impact on health outcomes. To achieve the tobacco endgame goal, combined policies, including denicotinization, TFG, tax increases, and retailer reductions, alongside strengthening the empower measures, must be implemented. Also, there's a need for further predictive modeling studies to tailor policies to specific national contexts. And thank you for attention, and I'm happy to answer any questions you may have.
The audience. So I've got a question for you. So when you were looking at the different studies that have been done, and some of them have modelled the same intervention, but in different studies, did you notice, did they have the same effect sizes that they estimated for those interventions?
What size?
Effect size. So the impact on, like, say, odds ratio or something, the impact on the smoking prevalence?
They all showed the assumptions and all the intervention effects, but we couldn't synthesize it. But it was really interesting to compare the different scenarios and results. But I think we have to, we need more studies and more we have to be we need more attention to these studies results, and I think that's really interesting parts of the modeling studies.
Excellent. And some good conclusions there about looking at equity and also different contexts in terms of lower middle income countries as well as high income countries. Any other questions? Okay, thanks very much for the presentation.